Assalamualaikum doctors. In this video I am discussing a communication that is a consent scenario about renal biopsy. So as usual I are CAP. So do you think it is a easy procedure? Asking 2 or 4 pieces of kidney tissue using small needle. Then these tissues will be processed and seen under the microscope to see what is going wrong within this kidney tissue. This is a way to diagnose hidden cause of the nephrotic syndrome. So it's a nephrotic syndrome patient, so we need to do the renal biopsy and we need to know what is the hidden cause. That's why the kidney tissue we are taking by a small needle. Again 2 or 4 pieces of the kidney tissues using small needle, then these tissues will be processed and seen under the microscope to see what is going wrong within the kidney tissues. This is the way to diagnose hidden causes of nephrotic syndrome. Local or general anesthesia. Local anesthesia. We'll give local anesthesia. Any certain preparations before this procedure: measuring the blood pressure, urine sample to make sure that it is free from bugs, blood test to make sure about the efficiency of clotting system, and if she is on anti-clotting medications must be stopped before this procedure. So there are some preparations what we do: measuring the blood pressures, urine sample to make sure that it is free from bugs, urine sample, blood pressure, blood test to make sure about the efficacy of clotting system. So blood clotting system we will check. And if she is on any anti-clotting medications must be stopped before this procedure. She is on cortisone. Does she needs to stop it? No need to stop it. So cortisone no need to stop. Just anti-clotting medication we are stopping. How much I need to stay at hospital? Follow up for 3 hours in hospital unless if kidney function tests are abnormal or home is far away from hospital or she is on some medications like clotting ones. So normally 3 hours he need to stay in the hospitals. We need to do the kidney function test. If she is stable and clotting systems and home is far away, then she will be stay on the hospital. Precautions after procedure. So what happens after the biopsy? You will be asked to lie flat for 2 hours as this reduces the risk of bleeding from the area of the biopsy or kidney. If you need to go to the toilet, we will give you a commode or urine bottle. The nurse will examine your urine to check for blood and will monitor your blood pressure. After 2 hours, you can get up and walk around. All being well, you should then be able to go home. So that is the procedure is that he will be asked to lie flat for 2 hours after biopsy, as this reduces the risk of bleeding from the area of the biopsy or kidney. If you need to go to the toilet, we will give you a commode or a urine bottle. The nurse will examine your urine to check for blood and will monitor your blood pressure. After 2 hours, you can get up and walk around. All being well, you should then be able to go home. What is the drawbacks of renal biopsy? Infection, but we are stick to sterile techniques, bleeding, blood tests done before the procedure to be sure about the efficacy, to be sure the efficiency of the clotting systems. The procedure done by expert hands by special needle, and we do local pressure after the procedure and pain, but painkiller given through the procedure and after that. So what is the drawback? Infection can be occur, but we are doing it sterile procedure. Bleeding can be occur, but before we are doing the blood test, and also if there is any blood bleeding occur, we'll take the proper step, and also it is done by expert doctor. And also there is special needle. We do local pressure after the procedure, and if there is pain, we'll give the painkiller. Warning signs I have to take care of, that is back pain and hematuria. So renal biopsy, if back pain or hematuria, then they need to seek medical advice. So this is all about renal biopsy communication. Thank you.